In this video, we are going to mainly discuss about polyhydroaminos. So, polyhydroaminos, if you see the amniotic fluid index should be greater than 24 centimeters, that is nothing but 25 centimeters. And if you see the amniotic fluid, it should be greater than 2 liters. And next, coming to the single largest vertical point or single deepest pocket, if you see, it should be greater than 8 centimeters. So these are all values of polyhydroaminos. So what are the causes? The causes of polyhydroaminos may be polyuria, or maybe swallowing problem, there is no swallowing, and also there is other problems. So what are these? Let us see. The first problems is polyuria. The polyuria you can see in multifetal pregnancy, because in multifetal pregnancy what happens is there are more fetus. So because of more fetus, both or three fetus, they form more urine, so polyuria. And another type of polyuria you can see in twin to twin transfusion. So in twin to twin transfusion, what happens is one twin will get oliguria because one twin is sharing their amniotic fluid to the other twin. So other twin will be having more polyuria. So one twin will be having polyhydroaminos and one twin will be having hydroaminos. So this is in turn leading to polyuria. So twin to twin transfusion, multifetal pregnancy, and next comes maternal diabetes. So if a mother have diabetes, then it will lead to hyperglycemia, right? In the blood there is hyperglycemia. So because of hyperglycemia, it will also forward to the child. In the fetus also there is hyperglycemia. So because of hyperglycemia, there is polyuria. So this is maternal diabetes. And another reason is high fetal cardiac output. So if the fetus is having more cardiac output, to compensate this, there will be polyuria. And also in the case of any renal abnormalities, fetal anemia. So if the anemia already there is low blood, so to compensate this anemia also there is polyuria. And next, hydrops fetalis. So hydrops fetalis, in the name itself you can see there is lot of amniotic fluid. So in the hydrops fetalis also there is polyuria. So this is all the conditions of polyuria. So swallowing problem. Actually the amniotic fluid, here you can see polyuria means it is a lot produced, but it is not swallowed back by the fetus. As the fetus is not swallowing, there is polyhydroaminos. So swallowing problems you can see in the case of esophageal atresia, or also you can see in duodenal atresia. So as they are blocked, the swallowing problem is there. And also there is intestinal obstruction, and also there is congenital diaphragmatic hernia. So this already congenitally diaphragmatic hernia, all the contents of stomach are coming out, so there is a swallowing problem. And also neural defects like anencephaly. So in anencephaly, or also in spina bifida, here actually the cranium is not developed well, so the CSF will leak into the amniotic fluid, and this will also lead to swallowing problems, because the neural centers like spina bifida and also the anencephaly, the swallowing centers are not working. So coming to other problems, in other problems you have parvovirus B19. So parvovirus B19 and also polyhydroaminos with IUGR. This is leading to trisomy 18 and even trisomy 21 are other reasons. And chorangioma of placenta. So all these conditions are leading to the polyhydroaminos. So what is the most common mild cause of polyhydroaminos? That is idiopathic. And what is the most common cause of severe polyhydroaminos? That is GI anomalies greater than NTD. So most common mild is idiopathic, most common serious is GI anomalies greater than NTD. So note that normally in fetus kidney disorders there is oligohydroaminos. So whenever there is fetal kidney disease, there is oligohydroaminos. But here there is one syndrome that is called as fetal Barter syndrome. So what is this? In fetal Bartle syndrome, there is a problem that here there is polyuria, salt wasting, dehydration. So this is in turn leading to polyhydroaminos. So this is a special case. Normally in renal problems you'll have oligohydroaminos, but here fetal Bartle syndrome there is a renal problem with polyuria and polyhydroaminos. So this is about polyhydroaminos. Now let us see, in some cases there is polyhydroaminos with a problem like hydrops fetalis. So if both are together, in what cases you can see this both? You can see this mainly in parvovirus B19, especially this parvovirus B19, and you have RH isoimmunization. This both are seen in this case, especially in parvovirus B19. The female who is working in a children, like in a school or some children associated with children work. So this is actually a disease of childhood. The appearance will be like a slapped cheek appearance. The cheek will be so red like someone has slapped. Okay, and also lacy pattern. There is lacy pattern on over trunk, lacy pattern on the trunk. Okay, and next is polyarthelgia. There is also polyarthelgia, that is the joints are swelled. So this is a case where you have seen the polyhydroaminos and hydrops fetalis. So this all conditions, lacy over trunk, slapped cheek, polyarthelgia, can be seen in parvovirus B19. Okay, so don't confuse, parvovirus B19 is also seen with polyhydroaminos with IUGR and trisomy 18, whereas polyhydroaminos with hydrops fetalis is seen in parvovirus B19 and all these conditions. And remember, here you also have RH isoimmunization. So what is the major problem of this polyhydroaminos? So polyhydroaminos is where as there is lot of amniotic fluid, the membrane is getting stretched, that is leading to preterm labor, and also there is perforated rupture of membranes, and also there is abruptoplacenta. Placenta is also abruptio, like sudden rush of amniotic fluid and shrinking of uterus, and will be postpartum hemorrhage, and there is malpresentation, that is unstable lie, and there is also maternal respiratory distress, that mother will get respiratory problems because of lot of amniotic fluid. So what the treatment for this? You do the serial amniocentesis to relieve this problem. So this is all about polyhydroaminos. We'll continue now with oligohydroaminos.